Hey, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and I'm super excited to be here with one of my long-term clients. She's very beautiful, obviously, and takes amazing care of her face and skin. So we're gonna work on just kind of defining certain areas of her face. She naturally has a lot of volume in her middle face. So what we wanna try and do is give her other areas of her face to be sculpted and defined. We're gonna fill out areas like the temple because her lateral cheek and cheeks are naturally already larger. Define her jawline, project the chin because she has the perfect nose and perfect lips, and just soften things like folds. And then again, regular wrinkles that people have like this where they move, we're gonna relax those with some of the toxins that we have. So lay on back and relax. You guys could see she has the heart-shaped look, so we just want to define that. You don't need a lot of filler to make someone have these signature feature enhancements, is what I call them. So when someone has a little bit larger naturally of cheek and lateral cheek, we want to balance the temple. So one of the areas we go to is we just go right into the temple, and what this will do is not only keep the eyebrow up, but it will also soften the balance between the temple and the cheek. And does anyone know in the room what that's called? The balance between the cheek and the temple? It's called the OG curve. And so we want this OG curve to be super balanced. You guys can see we just filled that out slightly. She doesn't need a lot, just doing a little. This keeps her looking natural. My favorite filler in this area is Radius because it actually builds collagen there, and it supports a lot of lift, so you get a lot of that eyebrow lifting that girls really like nowadays. But I will say there's a new person on the block, Volux, that I've been using in Dubai for a very long time, but people really tend to like it for areas like the jawline and the temples because it has a little more substance, so be able to lift a little bit more. So you can see that just balances the heaviness, not heaviness, but the large volume that she has naturally in her cheek area. So next we're gonna go to jawline, and she doesn't need a lot. We're gonna do jawline and chin. And my goal is you don't wanna bulk her, you just wanna make her look a little enhanced and a little bit more sculpted at that 90-degree angle. And what does that allow you to do? That allows her neck to be tighter, you guys can see, and it allows her to have more of that angled look and structured look that we want. Perfect. And just really just go like this and just sculpt it in, define it out. And so I'm gonna go to the front, and what I wanna do is give her some projection because we want her to have that heart-shaped look. We want her to look slimmer, we want her to look more defined. And you can see by this 3-point technique, huge improvement in the projection of her chin. I love how that looks when you come to the side, and you can see a really big improvement.
Wow, look at that, guys. She is looking amazing already.
A really big improvement in that projection because she has literally the perfect nose, the perfect lips. So now we want to balance nose, lip, and chin from the side. So I'm going to come over here again, not too bulky, just a little definition at the angle. So that'll give her more of that chiseled look. But we don't want to widen her like we would with guys. So this is more of a feminine approach. Little struts. Perfect. And again, I'm going to come back to the chin. Perfect. Give her a little bit more projection. Usually the chin, you guys, takes about 2-3 syringes, but what I'm going to do for her is I'm also going to do just a touch at her marionette line, just because this area, girls, we want to keep that lip turned up, and we don't want the jowls to start to form. So just those few little pokes right at the marionette, and you should be able to balance the lip corner and the chin together. So now if you take a look at all angles, you could see, look at that projection. And then the last part I want to do is just do subtle softening to her under eye fold and just a tiny, tiny bit lateral cheek just to pull things up. So what I'm going to do for her eyes, you can see right here, there's some hollowing, puffiness. By putting some filler right at the edge of the nose, it lifts this up. So we're going to put one little dab. Sorry, honey, I know this hurts a little. What I call the piriform aperture. That will support there. Then we're going to go to the under eye. Couple little blebs. She doesn't need a lot, just a little. And then again, like I said, 2 very minimal pokes lateral cheek, because this actually pulls the face back and gives her lifting and balancing. Perfect.
We have a question, Dr. Emer. Aren't you afraid of embolization?
No, I've done this for so long, there's really no risk, you guys. When you're doing very small aliquots slowly, the risk of that is minimal. We're also using reversible filler. So again, we're gonna go nice and slow, very small amount. Same thing to the piriform. And then lastly, like I said, just those little bits here. What this does is give structure to the foundation here that allows her to have a lot of lift. So that is it, you guys. It looks unbelievable. I'm gonna show you guys, we're gonna do an Emer reveal first. Let's wipe her eyes real quick.
If she's crying, it's tears of joy.
Always needle pokes, always hurt a little bit. So let's give her the phone and let's do the Emer reveal first, okay? That's where she sees herself.
Reveal.
So you take that in your hand.
So we're gonna give you the phone real fast.
Go ahead.
So I'm gonna have you grab
You
it.
take it in your
I
hand.
can't open my
Can you? Oh, is there numbing in there?
Mm-hmm.
Hold on, you gotta wipe her eye a little bit with water.
Okay, it's good.
Close for a second.
We're excited for her to see her results,
Close.
guys.
Close. All right, see if you can open.
That better?
Okay, now
so
hold the
I'll
phone,
give you
hold the phone. Now take a look at 45 degrees. What do you think?
It looks amazing.
So I brought the chin forward,
Mhm.
gave a little definition at the corner, lifted
Wow.
laterally, and filled the temple. I want to show you, come a little closer, because I want you to look at yourself from above, because that's where you're going to see those angles.
Wow.
And then look on the side view. Look at the chin.
Mm-hmm.
Look at that chin and jaw right
It
there.
looks amazing.
Isn't that beautiful? And that little bit, just that teeny bit
Gorgeous.
here,
Mhm.
here, and here.
Perfect.
Put it all together. All right, now we're gonna give you. Oh, I love it. She panned. She even
It's
panned. She
amazing.
even panned for the audience.
Gorgeous, gorgeous.
Okay, so
girl.
give her the mirror. Give her the mirror. Now take a look, because I want you to see. Nothing overdone.
Yes.
Just natural. She naturally had tons of volume, so just that subtle bit to the under eye. Fold a little bit, lateral cheek, jawline, chin. Brings everything together. And just so you guys know, the last time we did this was like 2 years ago.
Yeah.
So she really keeps that volume, which is amazing for someone super thin. It's because we're using some of those fillers that have a little more longevity. So when you're going to the doctor, now there's a breadth of fillers that are out there. Make sure you ask about which ones are out there, because just standard Jupiter and Restylane sometimes aren't the best. It just depends on what we're looking for. Here we used a mix or a cocktail of fillers for different areas that will last much longer for her and look more natural. So let's do a quick pan. And we're done. Female facial sculpting. Great start to the day.
Thank
This is
you.
amazing, guys. Look at this side view.
I'm gonna do this separate.